Welcome to the online recording of the 2015 World TB Day presentation sponsored by the Southeastern National TB Center. The presenter for this topic is Jevon Gibson, CEO of Community Health Solutions.
Thank you. Welcome to my colleagues in the fight against TB, and a special thank you to my colleagues from the Southeastern National TB Center for the opportunity to talk to you on this, our World TB Day. Today's message is entitled TB, Our Winnable Battle. It's apt that we start this message off with an image that you see there, the circa 1919, in which the gentleman is holding the door to keep TB out. TB has been around for quite some time. It's a battle that we've been fighting for decades, centuries. As a matter of fact, recently we found out that DNA testing has found TB in Neolithic fossils of a woman and a child from almost 9,000 years ago. This battle has been one that's been raging for quite some time. Scientists agree that this fight is one that we can win. Let's start off with a quote from a Dr. Robert Koch. Dr. Koch is the scientist and biologist that discovered the bacterial cause for TB. And he once said this: if the number of victims which a disease claims is a measure of its significance, then all diseases must rank far behind tuberculosis. That sentiment is a very compelling sentiment. And in that era, Dr. Koch and his colleagues saw a number of lives lost to TB. Since then, with the efforts of folks like you over decades, we've seen the TB numbers decrease significantly. But we also know that there are a number of things that must be addressed in order for us to win this battle. We know that there's work that must continue, and the work that you're doing embodies the best work around tuberculosis and tuberculosis control. So I want to take a moment to bring attention to what you've done in the field of tuberculosis prevention, control, and ultimately elimination. Let's take some time to celebrate what you're doing. Let's celebrate your success. Well, the one thing we know definitively is that your hard work across the states has raised awareness of TB through community-based training and education. We know definitively that in North Carolina, you've been hosting the TB respiratory conference for over 64 years. That's an amazing work, and it's a much needed body of work. We know definitively that in Kentucky, even though you're a low incidence state, you've developed TB awareness campaigns like this beautiful ribbon that we have here. Still spreading the message, still letting folks know that TB is important. And even in a low incidence state, the work is important. You've provided training and education to public health staff and providers. In Mississippi, colleagues have shared how one of the greatest accomplishments that they've seen is their ability to really engage folks who are on the front line, share the message about the importance of TB, talk about the synergies in their work, and identify ways of working together and keeping the message viable and active in the community. You've mobilized your communities by engaging different sectors, including various branches of state and local government. Our folks in Kentucky were able to get the governor's office to proclaim March as TB Awareness Month. That's good work. It's great work. And it's the work that's truly going to make a difference. You've partnered with other agencies and organizations to host TB conferences. You've engaged different sectors, and you've done this work in a way that's made a difference in the community. Your tireless efforts have allowed the message that TB is alive and well and thriving in socially and disenfranchised communities all across this country and around the world is a message that must continue to be heard. It's the message that you carry, and it's the message that makes this work critical, especially now. Well, you may ask, well, Jevon, why now? Well, it's very simple. One of your colleagues said something that I thought was an awesome quote. She said, our success or failure in this program of eliminating TB lies within each and every one of us, not just the health department, But in the minds of many, TB has become like a bad neighbor who just must be tolerated. She's been around too long and is not going away. I saw that quote and it made me ask a question. I traveling and through my travels over the course of the day, I thought to myself, I'm going to ask a few random people what are their thoughts on TB. Is TB still a problem in America? And what's interesting is in asking that questions, I got various responses, and I want to share some of those responses with you. I thought there was a shot for it. Why are we still talking about TB? Isn't there a cure? Don't babies get immunized for that? TB is really an issue in other countries. And I had a positive test once, but it wasn't a big deal. When we look at these quotes, we realize that even though great work has been done, there's still more work to be done. Your efforts have allowed folks to get information in various parts of the country, and you've shared information to multiple sectors. But if we're able to walk around in a day where information technology allows education and health promotion material to travel all around the country, and people are still asking the questions, is TB still a problem in America? When people are still saying things like, I thought there was a shot for it, or isn't it an issue in other countries? We know definitively that our work must continue. What do these quotes say to you? Well, what they say to me is our issue has two prongs. It's a multi level issue, and it starts with this apathy. Apathy. It also starts with perception. And the two of them together, if not addressed, are going to increase our disease prevalence. We're at a dangerous crossroads now, folks. Apathy and perception regarding this issue, regarding TB and the implications of TB in our work, in our communities, is making our work that much more difficult. We have to sound the alarm. Well, you may ask, why apathy, Jevon? Why is apathy dangerous? Well, it's simple. Let me first define apathy for you. Apathy is a lack of interest or enthusiasm or concern, especially regarding matters of general importance or appeal. Is it safe to say that TB is a matter of general importance? Absolutely. Is it safe to say there is a lack of interest or enthusiasm around TB? Well, contingent upon where you are, some of you may say, no, Javon, there is still a lot of interest. But our truth is we work in this, we do this line of work daily. And more than likely, we come in contact with people who share our interest. But there are other sectors, other communities, and other people who TB is of no consequence to them. These are the folks that we have to reach. These are the folks that are apathetic about this work. Where's the other area of danger? It's really around this idea of perception. Well, what is perception? It's the way you think about or understand something. In your work, I'm sure that you've noticed that the way that people think about and understand tuberculosis is that it's a disease that we've managed to find ways to cure. And so, therefore, it's a non subject now, it's a non issue. It's a disease that's a relic of the past, it's a non issue. It's a disease that occurs in other countries. So, why are we worried about it? You know, there are other things that we should be concerned about, like HIV or even Ebola. That's the perception that we fight against daily, taking a message to a people who have competing health priorities, people who need to understand that this work is still critical and that TB is still an issue that must go addressed. What is our truth? Those of us in the field fighting this battle daily. Our truth is very simple. We know that in 2014, the Ebola outbreak caused approximately 22 deaths per day. But we also know that in 2013, TB caused the deaths of 4,100 people per day. We know that TB is an airborne pathogen and Ebola is not. But we live and we also know that we live in a global society where thousands of people travel daily, and there really are no borders. Lastly, we know something that's very important, something that we take for granted, specifically as relates to airborne pathogens. Every living human being breathes. Every human being breathes. So the risk of a pathogen, unlike Ebola, that's transmitted by air, will always be a significant risk if it goes unaddressed. But here's our truth. Our truth is we are at a crossroads. Your efforts and the efforts of your colleagues across the state can and will help us to win this battle. How? How are we going to do it? Well, first, continue to do what you're doing. Be encouraged. Recognize that your work is necessary. Then, fight apathy by continuing to educate people about TB and its impact. People need to know what you know, and they need to be as excited about it as you are. Every morning, you lace up your shoes and go to the battlefield. And every day, you need to bring in another soldier in the army, someone in a different sector that may have a different perspective, that may have a different reach, and may have different access, influence, or resources. These are the folks that we want to bring into the fight. We want to reinvigorate our TB awareness campaigns. I know so many competing priorities, Jevon, so much work that still needs to be done. So many things that go unchecked and resources that we lack. But you would be surprised if you were to decide, listen, my work, a part of my work and my mandate in making TB a winnable battle as a TB controller or a TB nurse or a health educator is to take a look at our campaigns and find ways to get them to resonate with the millennials, to get them to resonate with a population that doesn't think that TB is still an important disease. Let's look at our campaigns. Let's retool our health promotion strategies and come up with ways that we know will reach the masses and resonate with them. How do we do that? Well, let's try using social media. Let's use technology and innovation to keep the TB conversation going. We live in a day and time where kids have the ability to reach hundreds of thousands of kids, other kids, with messages that, you know, arguably may or may not have very much meaning. I ate my cornflakes today. I did something else. How important is it to take the message that, guess what? There's a TB enemy out there, and he's fighting against your health and your wellness. And you don't know very much about him, but you need to. Let's be intentional about fighting perception as well. Well, what does intentionality mean? Well, if we know that perception is a part of the issue, let's be intentional about changing that perception. Let's use structured tools that are specifically targeted at getting people to realize that TB is still alive and well and is a significant issue in a global society. How will you do it? Use your tools, use your resources, take the message to the streets and to the different sectors. Continue doing what you're doing, but be encouraged. There are many, many people, many places that still need to hear the messages that you have. They need the new information. They need to be reminded of the best practices and strategies on the front line for fighting this disease. There's even perception in our health sector. And these are the areas that we have to be intentionally deliberate about fighting. Here's a really important piece, and the one that's sort of the linchpin for this message. We know it's challenging. You're fighting an enemy that's been around for thousands of years. You're fighting an enemy that even your colleagues or your peers may not necessarily see as being a real issue. You're fighting apathy. You're fighting perception. And in the midst of all this, you have to maintain your passion and commitment to this work. You have to be committed to fighting TB. You're a small but powerful army. who hold a very important message and cutting edge strategies to fighting a disease that has taken millions of lives. Your passion and your commitment to this work is the linchpin. It's the piece that will truly make a difference. Why? Because you must remember how important you are and your work is to keeping millions of people safe and healthy, not just in the United States. But remember, we live in a global economy that fosters a sense of interconnectedness that we can't soon forget. A global economy that brings people from all races, cultures, and creeds together on a daily basis in airports all around the country, where we encourage talking and connecting. Your work makes sure that we can do that safely without spreading disease. And more importantly, so that the sick among us can be treated and ultimately cured. My message to you for this World TV Day is a very simple one. Let's get together and let's win this battle. Thank you.